بيشرفني ويسعدني إني أقدم my dear friend دكتورة رشا درويش, and she's going to be speaking about staying fit and active with CKD. اتفضلي دكتورة رشا.
Thank you so much, Dr. Maya Hasaballah. Thank you, my dear mentor and professor. I would like to thank as well, my professor, Dr. Hani Hafiz, my dear mentor as well, and Dr. Gamal Saadi and Dr. Tariq Abbas for your beautiful teaching all over the years and being beautiful role models. برضه عايز أشكر my friend, my longtime friend, Dina Abdel Latif, and the beautiful organizer of this activity with all these very interesting topics. Actually, I did enjoy the different topics presented by my colleagues, and I hope that you enjoy mine as well. Today, I'm talking about staying fit and active with CKD. The major topics I will cover. First, what is the definition, or what are the definitions of fitness? Physical activity, what are the key facts? Epidemiology of physical activity all over the world. Fitness in CKD, and what is a practical approach to prescribe physical activity as an adjuvant treatment for CKD patients with adequate follow-up. First of all, what are the definitions of fitness? The term physical fitness means the person's ability to perform daily functions with sufficient energy, alertness, and without undue fatigue. While physical activity is different, it involves contractions of muscles, movements of the body, and increased use of the energy level above the normal. While exercise is a more developed term of physical activity because it involves a structured and planned activity performed on a regular basis over a long period of time. And the types of exercise in general are aerobic exercises, strength exercises, flexibility, and balance. It's important to assess fitness in its different levels, but the most important word I want you to all remember is the word maximum oxygen uptake on treadmill or cycle ergometer that I will talk about later during this presentation. Key facts about physical activity by the World Health Organization. We all know, of course, that physical activity has significant health benefits for hearts, bodies, and minds, prevents non-communicable diseases like cardiovascular diseases, cancer, and diabetes, reduces symptoms of depression and anxiety. I'm sure my dear colleague, Dr. Radwa, will talk about this thoroughly. It also enhances thinking, learning, and judgment skills, and ensures healthy growth and development in our young generations. As a conclusion, physical activity improves overall well-being. On the other side, physical inactivity, we all know that it causes many problems, including accumulation of visceral fat with all its problems, development of osteoarthritis, diabetes, anemia, Alzheimer's, atherosclerosis, and we can keep on going on the disadvantages and problems of physical inactivity. So we should conclude that we should have a worldwide fitness mania. We have heard about the benefits and disadvantages of physical inactivity. But the key facts in 2020 are, globally, 1 in 4 adults do not meet the global recommended levels of physical activity. Up to 5 million deaths a year could be averted if the global population was more active. People who are insufficiently active have a 20 to 30% increased risk of death compared to others who are actually active. And we have more than 80% of the world's adolescent population insufficiently active. So more than a quarter of the people worldwide, 1.4 billion are not doing enough physical exercise. And this figure has barely improved since 2001. So the WHO, one of the 9 targets for 2025 was simply 10% reduction in prevalence of insufficient physical activity, with other, of course, targets to improve the general health. If we look at the numbers regarding the global inactivity, the most inactive country was Kuwait with 67% of adults inactive. Most active was Uganda with only 5.5% adults inactive. And we can see that Egypt here falls into the category of having almost 45% of its population inactive. If you look at obesity in the Eastern Mediterranean region, we can see that unfortunately, Egypt had the highest level of overweight and obesity in this region, with a prevalence more in women compared to men. And the study done by the University of Washington in Seattle, published in the New England Journal of Medicine, and it claimed, unfortunately, that we are the second, following Saudi Arabia, in being the world's fattest countries. Well, this is sad because looking at our ancestors, they used to be pretty active in doing different physical activities and sports. And what about nowadays? We are apparently fanatics about football, especially having Mo Salah representing us proudly in the soccer world. But I believe that the majority of Egyptians are more into encouraging football rather than actually being physically active. And this is proved by this World Health Organization report, a fact check about insufficient physical activity, where the prevalence of physical inactivity among youth in Egypt was actually reaching the 83%. And they claim then that there was no actually reaction with no governance intervention or survey or national system response to change this fact. And I hope by now these have changed, inshallah. So this is talking about general population. What about CKD patients who actually have a severe medical comorbidity, which for sure is affecting their physical function and physical activity? Well, of course, they have poor exercise tolerance due to a variety of contributing factors, including anemia, poor muscle mass, cardiovascular changes, and pulmonary diseases. There are several factors happening and several problems happening in CKD. We have high risk of diabetes mellitus, hypertension, and depression, and insulin resistance. We have a high level of inflammation and oxidative stress. The sedentary behavior leads to decreased fitness and muscle mass and sarcopenia, with increased disability and increase in mortality in CKD patients. It is also very well known that the most common cause of death in CKD is cardiovascular disease. We have several cardiorenal syndromes. And of course, targeting all measures to protect the hearts of the patient are a must. And it's well known that physical fitness diminishes morbidity and mortality and prevents cardiovascular diseases. Also, the saying, use it or lose it, is true, especially in CKD, because as Dr. Iman just mentioned, that staying in bed or sitting around all the time makes them lose muscle strength and muscle mass. So we're having a vicious circle in this condition where actually the physical inactivity engraves chronic kidney disease, and chronic kidney disease leads to physical inactivity. So it's a vicious circle continuously processing and happening in CKD patients. So it's a clear message that we should prescribe physical activity as an adjuvant treatment for CKD patients with adequate follow-up. But to be able to do that in an effective way, we'll have to answer these questions first. First, how to properly assess the initial level of fitness and its development. What is the renal physiology in CKD related to exercise? How different should be our approach on CKD patients not on dialysis compared to patients on dialysis or transplanted patients? And what are the physical activity guidelines and precautions needed to be taken? And finally, what could be done to implement these guidelines practically? First, how to assess the initial level of fitness and its development in these patients. As I just mentioned, one of the major ways to assess cardiorespiratory fitness is maximum oxygen uptake, which is peak oxygen uptake. I will talk about it right now. Another test commonly used in studies is field test, which is a 6-minute walk. What is maximum oxygen uptake, peak VO2? It is the maximum oxygen consumption or maximum aerobic capacity. It is the gold standard to measure cardiorespiratory fitness and endurance capacity in exercise performance. It's used in most of the papers trying to evaluate the physical fitness in CKD patients or non-CKD patients. It involves an exercise made on a treadmill or a cycle, ergometer, and it is graded. What do? They do actually measure the ventilation and the oxygen and carbon dioxide concentration in the inhaled and exhaled air, and it's measured. The value of the VO2 max for each patient is when this oxygen consumption reaches a plateau. And this is actually the VO2 max. And this reflects actually how fit this person. The longer it takes to reach this plateau, the better the fitness of this individual. So it sets the upper limit of the production of energy and reflects the maximum rate at which the heart, lungs, and muscle can effectively use oxygen during exercise. This actually test is present in many gyms and also in many rehabilitation centers where actually they can properly assess the fitness level of the individual. These can be modified through exercise training. So we measure it at the beginning of the exercise training, and then after the program, we see how far it has been modified, reflecting how better the fitness of this patient developed. Another simpler test is the talk test. It's a very simple way to measure the fitness during moderate intensity exercise. It simply means that the participant can still talk during a moderate exercise. And that's why you'll find usually people encouraging people to have a partner during walking and to talk with him or with her and to see how properly you can talk. And this is a development of the talk test where actually they see the rate of perceived exertion, where it is divided into several different grades or scales, where it starts from the scale number 1 with very light activity, when doing very light activity like watching TV, for example, reaching the level 10, where the maximum effort activity is reported when the person is completely out of breath and unable to talk. What about the renal physiology in CKD patients related to exercise? This recent paper, talked about the renal physiology. And of course, we all know that the renal blood flow can decrease during exercise, usually because of most of the circulation goes to the muscles. The shunting happens to the muscles which are exercising. But it is more noticed, and the decline is more noticed when there is a dehydrated state of the patient. In the beginning, actually, there's a small increase in the GFR followed by a decline, especially with increased exercise intensity. And as a consequence, of course, the levels of intrarenal paracrine hormones such as renin, angiotensin, prostaglandins, and also ANP all increase in proportionate to the intensity of the exercise. So as a summary, in normal kidney, it's very important to have a proper hydration to be able to avoid this reflex mechanism. But in the case of CKD, we have many pathophysiological mechanisms which lead to exercise intolerance, including neural changes, pulmonary changes, skeletal muscles, as sarcopenia, I'll talk about them. The uremia and the metabolic acidosis affects the exercise tolerance, vascular changes, and cardiac changes. Regarding the sarcopenia, in the early stage, there is only decreased exercise endurance in CKD patients with still a normal mass of the muscles. But in late phases, we have decrease of the muscle volume, decrease of the muscle power, and muscle atrophy. Actually, the sarcopenia, it's variable in the different stages of CKD. It varies from 11 to 28% in those patients who are not on dialysis. And in more advanced stages of CKD, it can reach up to 65%. Another term that Dr. Iman just mentioned is the protein energy wasting happening in patients, especially on dialysis, where we have a high level of catabolism and protein degradation. And we know that this leads to increased incidence of infection in these patients, cardiovascular disease, frailty, and depression. And at the end, increases incidence of mortality. So talking about physiology and what are the therapeutic strategies to deal with these different changes, they talked about nutrition, as Dr. Iman talked, about also using specific medicines, and they mentioned exercise. They said that despite having problems in muscles, higher level of physical activity and walking led to slower decline in kidney function and reduced risk of renal replacement therapy and mortality. Okay, so now we know that we should prescribe physical activity as an adjuvant treatment for CKD patients. So how different should it be for patients not yet on dialysis compared to patients on dialysis or transplantation? Patients, especially in CKD stages 3 and 4, displayed poor physical fitness and reduced exercise capacity. And it also associated with all-cause mortality. Actually, they found that regular exercise training does not appear to worsen estimated GFR. And there was actually a recent meta-analysis was conducted, which proved that training did not aggravate proteinuria. Actually, there were no studies which have reported ever worsening of kidney function as a result of exercise. Several decades of research in CKD also showed that aerobic exercise training is efficacious in increasing the VO2 peak, which is actually fitness, and thus increasing the exercise tolerance. Regarding this paper, where they study actually the effect of exercise on kidney and physical function in non-dialysis chronic kidney disease, the conclusion was that regular aerobic and or resistant training improves physical and walking capacity for these patients. Yet mortality and kidney function and leg muscle strength effect was inconclusive. And also few adverse events were reported. So they stated that the safest type of program of exercise in this category of patients was regular exercise training with moderate intensity for 8 weeks to 1.5 years. This is regarding non-dialysis patients. What about dialysis CKD patients? As Dr. Dina mentioned, our major problem in dialysis patients is the complaint of fatigue. It is a complaint present in the early stages of CKD, and it increases gradually in different stages and reaches up to 97% of patients on end-stage renal disease. The physical activity levels in general is small in CKD patients, and it starts from 40%, but it reaches the lowest number in end-stage renal disease patients on dialysis. Okay, so we will try to encourage these patients on dialysis to perform exercise. These exercises can be done either on dialysis or on non-dialysis days. On non-dialysis days, they have to be including outpatient supervised aerobic exercises during these days. While actually exercise on dialysis was proved to be very beneficial. It proved to increase the peak VO2 between 20% to 40%. It improved better sleep in these patients. And also it caused reduced depression. Exercises which can be done during dialysis are mainly cycling, which can be done either while the patient is sleeping, like this picture, or sitting. And they found that doing cycling using mini bikes helped in preventing further fatigue buildup, which is actually the major complaint in this patient. And it's a very effective way to deal with this major fatigue with major complaint, and it's non-pharmaceutical, so it's a perfect actually solution. This drawing shows the comparison of what happened to patients who had actually intradialytic bedside cycling for 6 months of hemodialysis compared to those who didn't. And they found that they had increase in the VO2 peak, increased time to exhaustion, increased exercise intensity, increased functional performance, increased hand grip strength, and increased quality of life compared to those who didn't. Also, during exercise, during dialysis, we really kind of encourage patients to have regular resistance exercises, like this picture, using bands to increase the resistance, because it has proved that these improve muscle strength and exercise tolerance and slows down muscle wasting in CKD, as Dr. Imen mentioned, that one of the major problems is the muscle wasting in these patients. These exercises can also be done just by doing simple exercises against gravity or lifting small weights. All of these can help in increasing the muscle mass. But at the end, all the different studies, they concluded that a combined resistance and aerobic training appears to be more beneficial at improving the VO2 peak of these patients and improving their fitness level. In general, there are some recommendations that if they're going to dialyze during the dialysis, it's better to do it during the first half of the dialysis session, because it's well known that after that, they might we might have a fall of systemic blood pressure. Also, exercising after hemodialysis due to the same reason might not be the best due to the low blood pressure happening quite frequently to some patients after hemodialysis. Also, regarding the fistula, it is claimed that the individual can exercise the arm with the vascular access as long as the weight is not directly applied to the access site itself. So there is no problem exercising the arms during the hemodialysis session. And also to be able to know the exercise intensity, the rate of perceived exertion, which is, like we mentioned in the beginning about how the patient can talk, is more accurate in dialysis patients than actually monitoring the heart rate because it's not very accurate in this category of patients. And in general, special care has to be taken, of course, to the vascular access site for fear of infection or damage. So while on dialysis, aerobic exercise or combined exercises for these patients for at least 8 weeks to 12 months, 3 times per week, proved to be very, very beneficial to improve the cardiovascular function and the walking capacity in these patients. What about peritoneal dialysis? Well, actually, there were very few studies which were done on PD. In general, the same resistance and cardiovascular exercise program proved to be more beneficial in these patients. They should do more exercise because they might have more time for exercise. They don't have the rapid changes of volume status and electrolytes as hemodialysis. But in general, they should feel more comfortable by doing exercises when they have an empty abdomen. And like hemodialysis, it's very important to be cautious from infection of the catheter site during exercise. It's very important also to have realistic expectations on doing exercises, because the improvement actually in exercise capacity are quite attenuated if you compare them to what would have happened to a patient who is not having CKD. Despite the increase in muscle mass, still there is actually failing to be translated totally into functional improvement in strength and endurance. And many studies are needed to be done to totally understand what's happening and why this is happening in these patients. What about transplantation patients? Well, transplantation is actually, we all know, a dramatic improvement of quality of life. It is the freedom from the dialytic treatment, and it can be actually considered as starting a second life. So our expectations are that physical activity should not be a problem anymore. Yet, the presence of recipient comorbid condition, psychological and socioeconomic factors, and long-term immunosuppression use actually reflects negatively on the physical activity of transplanted patients. Especially of the immunosuppressives are corticosteroids, which is well known that result in a lot of side effects, including weight gain, osteoporosis, and sarcopenia. So physical activity is protective for many of these risk factors. Physical inactivity in kidney recipients have been proved that it was associated with reduced quality of life as well as increased mortality. It appears to be safe in kidney transplant patients, and it should actually improve quality of life and exercise capacity. Also, many other studies prove that it improves graft function, work capacity, and reduce cardiovascular risk. But the facts are that kidney transplanted patients show low rates of exercise. Why? Many suggested reasons. Of course, the transplanted patient is very happy to have this graft. He is afraid to injure the transplanted graft. Even the doctors, they are kind of silent about the benefits of exercise from fear of potential complications. The family members and friends that all have a protective attitude, trying to convince this person not to exercise. And also, we have the diverse ethnic and cultural backgrounds like we have in our country, where the value of exercise is totally different from a country to another. So what are the physical activity guidelines and precautions needed to be taken to describe exercise to CKD patients? In general, our target is to diminish the risks of exercise on this patient. First, it's important to determine the level of basal physical activity. It's very important to go through a thorough medical examination and respond to stress testing before starting any exercise regimen. Blood pressure should be always measured before and after exercise, and in diabetic patients, of course, blood sugar. Those who have difficulty in walking, which is there is a big chance of having that in a CKD patient due to the bone diseases and joint diseases, they can be referred to a physical therapist from the beginning. And those who have suspected cardiac disease have to be referred for cardiac rehabilitation before starting the guideline or starting the program of exercise. So to plan this kind of this system for this patient, we have to set realistic targets. We have to make the patient understand the potential benefits of exercise. We have to talk to them and make them understand how important it is for the general well-being of his condition and his lifestyle. We have also to identify attainable goals. We cannot talk to a young patient and tell them that you will have muscles like the others he sees in gyms. We have to actually convince him of reachable targets and also formulate a realistic plan. And it's very important to monitor progress and recognize improvements, to follow up. We have to understand that in CKD patients, the very famous sentence, no pain, no gain, which is present in most of the genes, is not applicable. We have to think more. While more may be better, even a little is good, because our target is to gradually increase the intensity and duration to diminish the potential risks during exercises. We have to start with long warm-up and cool-down periods. Flexibility and stretching exercises are extremely important in CKD patients because they are very liable to develop joint diseases and problems and bone problems. Yoga have been suggested in many studies that it helps a lot in flexibility and stretching and also in balance. And improving the balance in general diminishes the risks of falling, which again can cause fractures which might not be actually healing in CKD patients. So all of these are very, very important. These are different exercises or examples of how to stretch the major group muscles. We have to tell them that the stretch has to be slow, and we have to hold for 10 seconds. It should be repeated 3 to 5 times. It's important to breathe while doing the stretch to prevent muscle spasm. The exercise should include all the different muscle groups of the body, and that should be done 4 to 7 days per week. In general, the regimens should include always a combination of aerobic and resistance training for maximal benefit. And then the question is, what should I choose from the different exercises type? Regarding aerobic exercise, of course, walking is a man's best medicine according to Hippocrates, which is the simplest exercise of all. It could be walking on a treadmill, outdoor, or even just at home. Stationary cycling, aquatic exercises, aerobic dancing, any other activities where there is movement of large muscle groups continuously, or combination of several modes in the same time. And we have to be cautious that kind of more intense exercises like basketball or like soccer or like tennis, for those patients who want to do this exercise, they have first to kind of consider counseling the doctor to see if their physical condition allows them to go and to play these different sports. Aerobic exercises, water-based exercises are actually very, very beneficial because it was proved that they decrease the markers of stress, in addition to being very, very gentle on the joints of the patient in general. And when doing the exercise, it should feel somewhat hard or medium hard. It should increase the breathing and pulse rate, but it's not so hard that the patient cannot talk, even as we talked in the beginning, the talk test. The goal for cardiovascular exercise program is to work up to 30 to 45 minutes of continuous exercise on most, if not all, days of the week. The physical activity guidelines and precautions also include resistance training. But we talk about low-level resistance strengthening, not like this drawing. We use low weights and high repetitions and avoid heavy lifting. Other than using free weights, resistant bands or moving our body weight against gravity can be done. And again, initiation at low to moderate intensity with gradual stepwise increase is very important. These are different examples of gravity exercises, very simple exercises like raising up and down on your toes or climbing stairs, actually. And lifting weights can be done, but it has to be done very gradual. And it has to be done on very small weights, like 2 kilograms. They do 12 to 15 repetitions, and they repeat them 2 to different times, like 2 different sets. And if the patient feels comfortable, then he can gradually increase the weight by 1 to 2 pounds. Aerobic exercises in general, how long we should do them and how often, it is actually suggested that they should be done for 3 to 5 days a week to begin with this is the recommendation. So general exercise recommendation for CKD here actually is mentioned in more details, like aerobic exercises. They should be done more than 5 days per week. Resistance exercises 2 to 3 days per week. Flexibility, at least than 2 days per week. And balance exercises should be done more than 3 days per week. Also, there is a guideline regarding the different age groups, where children from 5 to 18 should have 60 minutes of physical exercise every day. Adults from 19 to 64 should have 150 minutes of aerobic exercise, while adults above 65 years should have the same number of aerobic exercise plus at least 2 days a week strength exercise. So actually, the adults above 65 years, they should exercise more than this age group. And if you look at the facts, this is exactly the opposite of what's happening in real life, where the group of individuals who are exercises usually between 22 to 34, and the least exercises are the age group above 45 and 65 above. So in general, it is best to start with stretching and strengthening, not to start directly by aerobic, and then gradual progression to cardiovascular exercise. It's very important to look at the specific contraindications to exercise, like electrolytes abnormalities, recent ECG changes, increased interdialytic weight gain more than 4 kilos, unstable dialysis patients and titrating medications, the presence of pulmonary congestion or peripheral edema. Also, it's very important to take care in contact sports like soccer or basketball or boxing in specific conditions, like patients with solitary kidneys, or in patients who actually had kidney transplant. We have to be very cautious because this could injure the transplanted kidney, in ectopic kidney, in polycystic kidney disease, or also kidney with urological abnormalities like severe hydronephrosis or whatever. These are very interesting guidelines, which are actually printed and given to patients, and which was printed in by National Kidney Foundation, how to stay fit with kidney disease. And it answers many questions that these patients might ask while performing exercises, like how hard to work while exercising. Also, when should I exercise? Like, for example, waiting after a meal. Or also mornings are better than evening because it can prevent sleeping properly. And when should I stop exercises? Like if you are short of breath, chest pain, of course, feel sick in your stomach, you have got cramps, all of these questions. And are there any times when I should not exercise? Like if you have a fever, if you have eaten too much, if the weather is too hot or humid, if you have joint or bone disease, all of these reasons can actually cause problems, and it's very important they know these facts before exercising. So we dream of the inclusion of an exercise psychologist or physiologist. Actually, what is an exercise physiologist? These are college-educated clinicians who are trained to improve and maintain physical and mental health and rehabilitate those with chronic disease and disabilities. These are present abroad, and these are participating in the exercise programming of patients in dialysis or CKD patients in general, and they help a lot because most of physicians don't have the time or maybe the knowledge to guide these patients through physical exercise. Also, we dream of incorporating high-tech gadgets and Zoom-guided exercise training, especially in this COVID era, because we all know that the presence of a big number of people in a small room can increase the incidence of spreading of the infection. So having group exercises using Zoom, which is actually has spread everywhere all over the world, could be a very, very smart way to integrate exercise into their normal lives. And also high-tech gadgets could help us to monitor the heart rate and to know if there is any kind of problem during this session of exercise. Also, we dream of having the portable hemodialysis machines, which are very easy to move with, so allowing these patients to have more flexibility in movement and a better lifestyle, and maybe more time to exercise. Another dream is that we as physicians should start by ourselves first to set the proper role model, giving us a more realistic approach in treating these patients, because it will make us healthy and more balanced individual, and thus it should make us better physicians. And we have started by doing that under the supervision of Dr. Hani Hafiz by having a sport day organized by the Egyptian Society of Nephrology. And it was a very successful day that we did several years in a row. We're hoping to continue after the COVID era. And I have to mention that we will miss our dear professor, Dr. Hassan Shaisha, Allah yarhamu, who was a beautiful addition and always enlightening any gathering with his presence. Conclusion, a multidisciplinary approach is needed to individually tailor physical fitness to CKD patients, targeting, of course, a better quality of life and diminish the mortality and morbidity. But we need more studies because we don't really fully understand and understand how to develop a proper physical fitness in CKD patients. This was written by a person who had been treated on regular hemodialysis for 16 years. He said, "The more I exercise, the better I sleep. The better I sleep, the better I feel. The better I feel, the happier I am. The happier I am, the more I try to accomplish. The more I try to accomplish, the more I do accomplish. The more I accomplish, the more optimistic I feel. The more optimistic I feel, the better care I take of myself. The better care I take of myself, the more I exercise. The more I exercise." So this is a type of good vicious circle we are targeting in our patients. And maybe this is the biggest dream, that maybe one day we will have a marathon on the pyramids, including our CKD patients and the nephrologists of Egypt. Thank you so much.
Thank you very much, Dr. Rasha. A beautiful talk and a very energetic message for all of us. And we hope that next year we can make, or maybe this year we can make again this sports day. And the World Kidney Day next time will be again in the gardens of Al-Azhar, not only by Zoom. Thank you very much.
Inshallah. Thank you, doctor. Thank you.
Now we will move